So super fun, and the goal on this is permanently getting rid of these fat cells. They're being lysed as we speak. We'll put a little ice on there, and I'm super excited to see this stomach kind of come right through here.
Me too.
Traditional protocol, you can do this many different ways. I don't know if anyone does this in the Midwest. There's a practice who does this, one in New York and one in the West Coast. Actually, one of my friends is a huge CoolSculpting practice. I think one of the reasons that we talked about is there's not a lot of people who do CoolSculpting are not qualified to do injectables at the same time. So like I said, Alan's always overqualified in that sense. But you know, we all have these areas that we're like, hey, I really am into this because I want to improve it for myself. When we get in those areas, we think about it differently. I think we relate better to those patients too.
Absolutely. Every time I do CoolSculpting, I show them my results too as to how I transform throughout it. Because the more you're vulnerable with your patients, you also let them in, but also let them see the actual results on yourself, and you can kind of parallel to them.
What do you think of women in Kybella and CoolSculpting? Your thoughts?
I honestly think it's an amazing opportunity to kind of get those stubborn areas away and gone. And they are very effective. They work super well. With CoolSculpting specifically, I've seen the underarms and the submental area, and then I also pair it with Kybella, especially here if you do have a double chin that you're upset about. It's a nice combination to get rid of that.
Do you like CoolSculpting first, then Kybella, or Kybella first, then CoolSculpting?
I think it's pure like the assessment. If I see a patient, if they are a candidate for CoolSculpting, I typically will target that first and then get rid of any other stubborn area with Kybella.
And mine was, the day I did it was Kybella, and then right after CoolSculpting. Actually, I like that because the CoolSculpting right on board, it was like this immediate cooling, and you had both those areas potentiating, working together. How long do you think it'll take you?
I don't know. I mean, I want to give it at least a month, just for it to really kick in and kind of shave away, and then I'll be working out in the meantime too, so hopefully it'll look really great.
And that's a point that you don't want to dismiss, working out.
Yeah.
So let's talk about that a little bit. When you do liposuction, so again, I'm a face guy, not a body guy, but we'll talk a little bit about the science. When you do liposuction, what you're doing is you're removing visceral, so you're removing subcutaneous fat, but your visceral fat kind of stays intact. Since your body tries to equalize itself, when a lot of patients get lipo, they look good, and then what happens is they're going to get, you already know what I'm going to say, right? Rebound. And it goes into some other area. So your body's going to want to kind of equalize itself. So you have to be really strict. So if you're thinking about workouts, you want to make sure you're not going to get that rebound. So for me, I do, and I've done this for a while, I do abs every night. And I don't do like me doing abs. I used to do abs, which is essentially you do sit-ups until you're like, I'm done. I put on a video, and I'm like, let's find the most difficult ab video I can do. Is it 7 minutes? Is it 10 minutes? Is it 30 minutes? And then you really want to be on it, especially right after you work out, or after you've done CoolSculpting or Kybella, because, or lipo for that matter, because it's going to want to come back. And so that's kind of nice that you can you're going to get that extra potentiation. Your body's going to want to get that back. It's going to readjust after you've been kind of that same level, and then usually you don't get it back if you've done that.